One. What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Today, I have a very special guest, Dr. CeCe Brooks. She's a doctor of nursing practice, holistic and functional medicine expert, an expert in neuroimmune syndromes such as Lyme, babesiosis, Bartonella, etc. Welcome to the show, Dr. Brooks. Do you go by Dr. Brooks or Dr.
Thank
CeCe?
you. You know, it's weird. In practice, I go by Dr. Brooks, but then on my Instagram, I go by Dr. CC. I don't know why that happened, but I guess it kind of separates it for me. So either one.
Yeah. And so, how long have you been practicing?
So in Georgia, I have been practicing for 6 years now. And I mean, straight out of school, I knew that I wanted to go right into functional medicine or holistic something. So I started in holistic pediatrics out in Roswell, actually, and then made my way onto the functional, more chronic side of patients. At that point in time, I dealt a lot with kiddos on the spectrum and just approaching their health and wellness in that functional kind of root cause mindset. And then that progressed to seeing adults. And my heart and soul goes to my Lyme patients because, as that's what I struggled with for so long. So it kind of just progressed over the years. And now I have two very separate entities. Part of my practice is my newborns and my kids, and being very preventative with them and holistic remedies, and just making sure parents know that they have options and being supportive of those options, and not making them feel judged or like they're going to do harm to their child for certain decisions. And then the other side are my chronically ill patients who have just unsolved mysteries, unresolved symptoms. Nobody knows what's going on. So I have a heart for both.
Yeah, absolutely. And it's interesting that you say that because I hear that all the time. No one knows what's going on. And then I ask, well, have they tested for A, B, C, things that are just like forefront of my mind, your mind,
Yeah,
mycotoxins, Lyme, Bartonella, Babesia, Mycoplasma, HHV6. No, well, no wonder they don't know what's going on. You can't find what you don't look for. I mean, these are just
exactly.
really basic things to test for. I
Yeah.
think, in my opinion, there's an immune system component or an infectious component to almost everything. For example, people with elevated Coxsackie B type 4 viral titers have a 33% increased chance of a cardiovascular event. But how
Yeah.
many cardiologists or cardiology providers are testing for viral titers? Almost none. Three,
Right.
four.
Drives me crazy because it's so, and I love that you just said that. To me, it's so basic.
Yeah,
Looking at those viral titers, looking at reactivated viral titers, things that we should and should not come across, looking at baseline labs. I call them my baseline labs. And when I get a patient in front of me, they're like, I've never seen my body on paper like this. And I'm like, to me, we haven't gone down rabbit holes yet, even. We haven't touched
right.
anything. Yet. This is just surface level. And it's wild that people don't have access to that, or if we did, how preventative we could be. I just went
Yeah.
on this whole rant about Alzheimer's with the same thing in terms of infectious agents. And there's links to strep, Borrelia burgdorferi, high Lyme bacteria, and other
Mhm.
infectious agents. And it comes down to neuroinflammation. It's so easy to look for and
Yeah.
to test.
Absolutely. Microglial cells. It all comes down. There's a good book. I have it downloaded on my computer. It's a textbook called Microbes and Mental Health. But it
Ooh,
ties into everything you're talking about in terms of microglial activation. So long-term microglial activation, as you know, is going to lead to neurodegeneration. But as Dr. Dietrich Klinghardt says, he's never treated someone with MS, Parkinson's, Alzheimer's, any neurological condition that didn't have Lyme, mold toxicity, Babesia, or Bartonella.
100%.
And neurotropic viruses, they love to get in the myelin,
Yeah.
inflame nerves, inflames the central nervous system. And so, and that's one of the reasons why low-dose naltrexone, the compounded medication, works so well. I've had people call me up and say, "Oh, I'm smarter now," and I'm like, "You were smart all along. It's just we
You
removed
just
the
didn't know it.
inflammation."
Yeah, absolutely. I have a current patient ongoing with MS, and her over the past, I would say 5 years, I've seen her. She had Lyme, all those co-infections, heavy metal toxicity, and everything's clear. We were doing NAD IVs for a while, phosphatidylcholine IVs for a while, certain peptides rotating through. All of her lesions are gone. There was five big ones. All are gone. The last time she had a neurologist appointment about a month ago, and she came to me afterwards, and he said that they are all gone. There's remnants of damage from one that we can absolutely work to recover, but it all stemmed from infectious agents. And then you have to go in there and help the body heal, right? But
Right.
it is just like that is preventative medicine to me. And it's so easy to look at those things. We have it available instead of just
Right.
waiting, for someone's downfall and then dealing with someone who's chronically ill and trying to reverse it. We could be so much more preventative, and it drives me absolutely nuts that we're not.
Yeah, and even when you look at arterial plaque, there's a strong component of foam cells, which are immature macrophages. So why would
Why?
immune cells
Yeah,
be in arterial plaque? They're trying to wall off the pathogens to
exactly.
protect your heart, the myocardium, from getting infected, which is going
Exactly.
to decrease cardiac output, ejection fraction, all those things. And so, there's the guy, Dr. Ravici, I think was his name, back in 19 like 20s or something, who talked about, pathogens, viruses, how they downregulate metabolism. There's the term microbial mitochondriopathy. Basically,
Mhm.
the inflammatory cytokines beat up the mitochondria. Your husband's an MMA fighter, so it's
Yeah.
like having an MMA fighter go after your mitochondria, right? And if you don't
Beat 'em
have
up.
exactly, if you don't have the glutathione levels that you need to, or the superoxide dismutase levels, those bodyguards are gone, and some mitochondria are not protected by histones, so they're just kind of hanging out and they're just taking punches left and right.
Yeah.
But the NAD, like you said, mitochondrial health is important. So NAD can really
Mhm.
help. I think the cell sometimes when I've seen NAD not work, I think it's the cell danger response, is activated, and so mitochondria can't produce any more ATP
They're not ready.
until
Yeah,
yeah. And
essentially.
so yeah, so it's not that the NAD is not working; it's just it's being diverted to the cell danger response, I think.
Yeah. Absolutely. And I feel very similarly to when someone comes to me saying they have a diagnosis of lupus, let's say, and that ANA is turned on. It's just a matter sometimes of asking why.
Right.
That autonuclear antibody, it does not just turn on for no reason. It is trying to protect you as its host. It is trying to protect you. And unfortunately, it goes after our own tissue in doing so. But what is it going after? And,
Right.
patients who have more of those autoimmune like disorders, when they come to me, that's the first thing I say to them. Or if they're on, some sort of long-term steroid and they're like, yeah, it works. Okay, well, let's explain why it works. It's working because it's
Right.
suppressing immune response. So why is
Right.
our instinct to not go after that and what it's going after, what it's suppressing? It's just a matter of asking why sometimes. And you're right. I think a lot of it comes down to inflammation, inflammatory cascades, overloaded viral thresholds, and or other microbes that are going on, maybe parasitic organisms, maybe bacteria, pathogens, whatever it might be, or some other toxicity that is damaging the cell and causing an uptick in oxidative stress.
Right.
It sounds much more complicated than it is, but it's not. You just have to go down to a cellular level and you will figure it out.
Yeah, normally during the past few podcasts, I've had my molecular hydrogen nasal cannula. I'm breathing the gas because I'm doing back-to-back consults. I figured why not, right?
That's awesome.
Breathe the molecular hydrogen, and that's something that's good for for like your husband. It would be great for performance enhancement.
Yes.
But it can also there's really no medical condition or health condition that it hasn't been shown through research to benefit because the molecule is so tiny. It not only gets into the cell, it gets into the mitochondria. And before molecular hydrogen, the only way we really knew of to stimulate mitophagy, the production of new mitochondria, was aerobic exercise. But now molecular hydrogen, I breathe the gas more so than drinking the water, just because I get busy. But I
Yeah.
think that's something that can mitigate cytokine storms, like with that virus that was going around the past few years.
Yeah.
I have
That
I've
virus.
heard of one MD, yeah, I've heard of one MD who got rid of her Lyme, using a few other things, but mostly molecular hydrogen to optimize her immune function.
I 100% believe that because also at the end of the day, I'm a firm believer that our bodies are meant to heal itself. And
Right.
sometimes you just have to give it the tool. Sometimes it's not about actively targeting or going after something, but about taking that human and their immune function and optimizing that to then use them against whatever you're trying to go after. It's
Right.
not always big protocols against these pathogens are not always warranted. So something like that is a wonderful, explanation and example of just that. Speaking of kind of brain inflammation in athletes and all that, do you ever use synapsin? I know we talked
Um,
about
yeah,
compounding pharmacy
RG3.
before.
Yeah.
Yeah,
Yeah.
RG3. I
Yeah.
do love RG3 for athletes and also for more of my neurocognitive patients when I don't know what's happening, when I don't know where, what pathogens are going on, or if there is a neurocognitive component or a neuroinflammatory component. I love synapsin.
Yeah, it's good stuff. I actually got it from Josh.
Yeah.
And they have that, I think it's once a month, the Atlanta/Alpharetta Functional Medicine Study Group. Sansa Curtis runs it.
Yes, I know
Um,
Curtis.
yeah, and I was given, or I was answering a question, and she said, "I don't know what he's taking, but I want that."
Yeah.
Um, it was the RG3 synapsin. But yeah, I think that's good, especially, the route of administration with the nasal spray.
Yeah.
If you combine it with something like transcranial photobiomodulation, the red and near infrared light, which I have, the company sent me one. I wear it in the forehead sometimes. I think that's along with PEMF, molecular hydrogen. Those are things that no matter what you're dealing with, they're addressing more the 30,000 foot view. It's not targeting something specific, but without it, if you add electrons to the body, you're going to decrease inflammation,
Yeah.
right? And so the Schumann resonance, that's going to always help. One thing I've gotten into the past few years, I'd love to get your thoughts on, but had this book here, 6 Foot Tiger, 3 Foot Cage, and it's
Uh,
about maxillary deficiency and jaw malformation leading to sleep disordered breathing.
yes.
And one thing I learned a few months ago is that, if you measure oxygen saturation with a pulse oximeter, and let's say it's 95, well, at the tissue level, it could be as low as 90%, which is very significant. And
Mhm.
so I have an oral appliance, mandibular advancement appliance, and I sleep with nasal mutes to keep my nasal passages open. But I also have a tongue tie I have to get released with a laser.
Yes.
And that's something a lot of people miss. In my experience, ENTs and pulmonologists do the worst job, not all of them, but most of them, but airway centric dentists who are just looking at the airway. Because the pulmonologist, I had to see him first to get my oral appliance covered. And he's like, "You, Dr. Tim, you got to have a CPAP." I'm like, "No, I don't." Like, because you're forcing oxygen, but down the throat. But if the tongue is malpositioned and falling down the trachea, I mean, it's not going to really help.
Yeah.
And not to mention, it disrupts your sleep. So, and I was able to get my dad off of a CPAP with a mandibular advancement appliance. But do you look at oxygen saturations and do sleep studies?
So there's so much in that. My brain is going wild right now. So first, if you bring it back to even a newborn state, the amount of newborns that I see with tethered oral ties has exponentially increased in the last 5 years, I would say. I did not used to see as many as I'm seeing now. And I agree with you. My number one stop is first to see if we can not intervene in terms of laser, and see they're so malleable when they're newborn. So to see if we
Right.
can that with certain exercises, and stretches and things like that. But then secondarily, I don't send them to the ENT. I send them to, there's an awesome in Roswell, there's an awesome integrative dentist who specializes in oral motor coordination and function and the tether oral ties for my kiddos. The basics of that I don't think enough people understand is that oxygen is our major nutrient. It's our main nutrient, right? We know we would die without it. But we forget that that oxygen goes through the nose for a reason, right? Our nose is what filters that oxygen. It is what removes particles and pathogens. And if we are taking in that oxygen through our mouth, we are not taking the CO2 that we need to, taking out the CO2 that we need to. And therefore, there's tons of studies that then link that to inflammatory responses. And so it's not just about this baby latching well or taking the bottle well, or later in life not snoring. Nobody tells you that that process is integral to your health chronically in the future, because most disease stems from inflammation. So yes, I'm a huge believer, from the start, to make sure that oral motor coordination is appropriate, and that my kids, the babies that I get, are not mouth breathers. And if we are, then we're figuring out, how to fix that then. For adults, I love that you just said that in terms of getting not using a CPAP and getting off the CPAP, because yes, if your oxygenation is low from your fingertip, you can imagine
Right.
what's happening intracellularly. So yeah,
Right.
I love all that.
Yeah, and I think a lot of times, and I had to learn this the hard way, you won't fix the thyroid or gut dysbiosis or anything for that matter until your oxygen saturation is optimized. because not only are you not getting deep sleep, your lymphatic system, the lymphatic system in the brain, is not able to get rid of those metabolic waste products. And you're in a fight or flight state, so your autonomic nervous system is dysregulated. So
Yeah.
there's this whole, all these clinical sequelae that happen because you're desatting at night. And as we age, HIF1, hypoxia inducible factor 1, increases. And that's why I also learned that, if you take someone who's desatting a lot and they move to oxygenating themselves very well, they will be more inflamed temporarily because you're kind of flooding the cell with oxygen. So until the body recalibrates and goes back to homeostasis, but long term you got to do it, and you'll feel much better. It's anti-aging. I mean, that's probably the best anti-aging thing we can do.
Yeah.
And I think without oxygen, glutathione is great. I love glutathione, but it's not the most important nutrient. It's oxygen.
Oxygen. Yeah, absolutely. And if you're not utilizing oxygen well, then what the heck are you doing well, past that?
Yeah,
100%.
and it's interesting. Like, so if you go to a traditional provider and you look at body temperature, I tell people all the time, just a few tenths of a degree drop in your body temperature, immune function goes.
Yes.
And so there's two ways I remember from cell molecular biology. There's two ways to change the function of a protein: change the temperature, change the pH. So you're changing the temperature if your body temperature is lower. And then, but they'll say, oh, 97.5. Oh, good job. Good job. No, not good job. So, we don't have to always do a lot of invasive, expensive tests to get important data. And then the oxygen saturation, same thing. If you're 95, 96, they're going to say, good job. I mean, you're alive, but you're not going to feel well. Unless you're at like 8,000 feet above sea level, you should be 98, 99 most of the time.
Right. Yeah, I think that this topic in its entirety is so important because of the basics of it. I say this all the time. I wish before patients could even get in front of me, I had to put them through 3 months worth of just modalities that they can do at home. You mentioned cortisol and regulating the autonomic nervous system. Our bodies could heal so much better and easier if we are able to get out of that fight or flight. Oxygen is just one part of that, right? But if I could have all these patients go through just a couple months worth of re-regulating their central nervous system, of re-regulating their immune system, of simple things like breathing properly, then by the time I get them, I promise you those labs would not be as drastic as they are without all those modalities, put up front.
Right. Yeah, exactly. And I think in terms of, testing for sleep disordered breathing, the pulmonologist even said to me, well, we don't always treat snoring. And I said, well, therein lies the problem. Like, it's on a continuum. Like, just because someone's not all the way over here, not in the ICU, doesn't mean it's not significant, not impacting their ability to function and live a great life and have a good health related quality of life. I
Mhm.
think, traditional medicine has people in the habit of thinking the absence of symptoms means I'm healthy. But it's
Right.
just like during the past 4 years, people would say, oh, this person was perfectly healthy and they, got the infection and they died. I'm like, well, did you have a CD4, CD8, CD56, CD57? No. Oh, well, then how can you say they're perfectly healthy? Well, they didn't have symptoms. Well, that doesn't mean they're healthy.
Exactly.
Just because my car's not breaking down doesn't mean the oil is
Right.
optimal, the gas is optimal. You
Right.
know, we got to change the way we think. And then I think a lot of times people, when they initially come to integrative and functional medicine, they are in the mindset of, okay, I have A wrong, I'm going to do B to correct it. But in reality, there's not one root cause outside of trauma and pregnancy, right?
Yeah.
There's multiple root causes: mycotoxins, infections, gut dysbiosis, environmental toxicity, hormonal imbalances, sleep disordered breathing. And it's not that you have all these different issues. It's just a matter of we could have 100 people with the same symptoms. 15 of them may have mostly sleep disordered breathing and mold toxicity. Another
Right.
15 to 20 may have mostly metals and sleep disordered breathing and some gut dysbiosis.
Right. And it's all too, you kind of alluded to this earlier, it all too comes back to that immune function because you can have one family who is exposed, let's say we know that they're actively exposed to mold, and I have a dad who has a little bit of fatigue. Overall feels fine, fine, but a little bit of fatigue. Mom having reproductive issues, menstrual cycle issues, child who has severe chronic eczema, another child who has recurrent URIs, or upper respiratory tract infections. And they'll come to me and say, well, why? If we're all exposed to the same thing, why is it presenting differently? Or why doesn't this person have a problem?
Right.
And one, bioaccumulates differently. Two, our detox pathways are different. Our abilities to methylate or to activate certain things are different. Our genetics are different, even between siblings or between mom and spouses. Your genetics are different. So your tolerance is going to change or be different than the next
Right.
person. Also, than what we're exposed to previously to that moment, what else is going on, although you felt okay in your
Right.
immune system. And then that dictates how you handle that mold exposure.
Right.
So absolutely, I think a lot of that comes down to patients not knowing, and nor should they. It's not their job to know. It's our
Right.
job to, like, this is a yearly lab that you run to understand your body and to then understand, okay, if we do have this exposure, how do we prevent it from becoming a chronic problem?
Right.
And it comes down to supporting the immune function and making sure you can process and handle information to the best of your ability.
Yeah, and I think we also have to hold building contractors and home contractors more accountable because when you, at least around here, and I saw it in Georgia too, they're building new homes, they put up the framework, they may not come back for 2, 3, maybe
It
even 4 weeks.
rains.
It's
Yeah.
raining, so you already have a building conducive to mold growth. And then, the may not be constructed from a proper structural standpoint. It may not be structurally sound. And so then you have increased likelihood of moisture accumulation. Then
Mhm.
you add 5G and Wi-Fi, so the mold spores release more mycotoxins.
Yep.
Then it's built to be energy efficient, so there's not a good exchange of indoor and outdoor air. You get
And
mold
radon
behaves.
around here.
What's that?
And radon around here.
And radon, exactly. So all those things, and a lot of people, I mean, I hear it all the time. I've heard it for over 10 years. Oh, I don't see any mold. I'm like, well, unless it's Stachybotrys, you most likely won't see it. And even
Right.
with that, it can be behind the walls, it can be underneath a bathtub or shower, it can be inside a washing machine, especially the front-loaded machines.
Yeah. Or you
And
get
so,
well, it is a new build. I mean, we just built this house a year ago, but from the point that you said, yes, I just saw this video of 4 houses in a row and just the bare bones were up with the wood structure and it's pouring rain. And you think no mold is going to, grow in that moist environment?
right. Yeah, so that's a great point because I had someone last week and they were like, "Oh, well, my house it's only like 2 years old," and unfortunately, I had someone when I worked in North Carolina. She was a figure competitor, and her house was like 2.5 years old. She was single and she rarely went upstairs, and there was a leak she didn't notice, and she gained like 14 or 15 pounds in 2.5 weeks. I mean, nothing changed in her workouts or nutrition plan, but I could tell her eyes were jaundiced, so I had the nurse practitioner push some glutathione, and the light bulbs kind of turned back on, and she moved in with a friend while they remediated her house. But this is serious stuff. But because home contractors aren't really held accountable, and judges aren't aware most of the time, 99% of the time, they're not punished for leaving things unfinished or doing things haphazardly. I mean, if you and I did those things in the wellness integrative medicine space, we would be in prison.
Right.
You know,
Stripped.
exactly. They just, get away with it. But I think there's a structural standpoint, there's the detox standpoint, there's the non-native EMF standpoint, and all those things play a role. And it's not just for people who don't feel well, it's also for performance enhancement. So if you want to perform better at anything, it doesn't have to necessarily be a sport. Your mitochondria need to be firing on all cylinders. Your
Right.
brain needs to be, reaction time's got to be good. And, blood flow, mold is going to decrease blood flow to the frontal lobe. So your executive decision making is off.
Right.
And do you see that with people?
I do. I mean, I've had patients who are put in patient facilities for hallucinations and psychosis, acute psychosis because of mold toxicity. So there's no doubt that there is a significant cognitive component there for some patients. I wouldn't say it impacts all my patients like that, but I definitely can see a fatigued brain. We love that word brain fog, which is such a big, conundrum, but the term brain fog for most patients. But then I have seen true psychosis from mold
Right.
toxicity. Absolutely.
Yeah. And I've had people who were addicted to illicit drugs, but it was because their brain was so inflamed. The only way they could feel remotely normal was to, go on those illicit substances. And then we address the mold. And, it doesn't happen overnight, it takes months. But they're able to get off the drugs And we make sure they get the proper supervision as well. But we address the root causes, and then the cravings aren't there. And
Right.
so those microglial cells, the white blood cells in the brain, aren't inflamed. And so they're like, oh man, I can think so much better. I don't have those cravings. And it manifests differently. Some people may crave food. Some people may crave illicit drugs. Some people it may be gambling.
Yeah.
You got however you like your dopamine served,
Right.
that's how it's going to manifest, right?
Right, absolutely. And I think another important kind of factor there too is that I get a lot of questions about, well, isn't mold naturally occurring?
Yeah,
And, sure, I used to live in Florida. Mold is everywhere, right? It's really very hard to not come across mold in Florida. But again, it's not normal for it to bioaccumulate. It's not
right.
normal to cause these chronic symptoms. So I always, we can go in depth in terms of where this exposure is happening. But for my patients, I always prioritize, okay, what can we control? We can
Right.
control your current home. You need to make sure that you do not have an exposure now, because this also might be a test where you had an exposure 2 years ago. And as
Right.
an opportunistic organism, this mold is just brewing and kind of domino effect and suppressing your immune system further and breaking apart your T cells and your B cells, where now you have catapulted into a chronic illness from an exposure a year ago. So we control the here and now. Make sure your home environment is safe. If able to, I catch a lot of heat from offices or schools where I'm like, hey, if you can go in there and you're spending a lot of time at work at an office and you clearly feel better when you are out of that office, it needs to be tested. And then you get hit up with, well, it's not covered by insurance, so they won't do it. A whole long issue we don't need to go into. But, schools, work, home, that's what we can control. And then eradicating it and making sure next time if there is an exposure, you are not impacted like it, from it like you were this time around, because your immune function is stronger. And then,
Right.
I like to give my patients kind of a baseline protocol that if you are traveling, if you do, are going to Florida or somewhere that's more notorious for mold toxicity, that you carry a little bit of glutathione or a little bit of NAC or a good little binding agent. You don't have to do this whole protocol, but know the tools that if you are exposed or think you are exposed, to start taking right away.
Yeah, absolutely. So I mean, I recommend for people binders. You don't have to do cholestyramine, so don't freak out.
Yep.
That's kind of the old school Dr. Shoemaker
Yeah.
Mold Warriors way. But I like, some of the binders from Cellcore,
Yep.
the carbon-based binders. I like the Patricia Kane protocol, the lipid replacement therapy, rehabbing the cell membrane. But like you said, the glutathione, I like acetyl-glutathione on an empty stomach, or NAC, milk thistle just to keep phase one and phase two moving, and then TUDCA to keep the bile moving. But the other thing I see, and I learned this the hard way too, is a lot of times mold spores will colonize the paranasal sinuses. And then even though we've detoxed systemically, they're being poisoned from within. So actually, there's a guy in Atlanta, Don Dennis. I think he might have just retired. He's an ENT, but he's the guy behind the microbalance health products to
Mm,
address mold, like the
that's right.
EC3.
Yeah, yeah.
Yeah. And so it's a protocol with Dr. Hannah's nasal rinse. And then you take the Citra drops and you mix 4 to 5 drops for every 8 ounces of water. And you just rinse your nostrils 2 to 3 times a day.
Yeah.
And that really helps.
You ever nebulize? Because I found the rinsing helps with nebulizing, especially if I've had patients with mold toxicity within the lungs. So do you ever find yourself in a situation where you're advising them to nebulize as well?
Yeah. So sometimes I'll recommend that they ask their local prescriber for something like amphotericin B to nebulize. I mean, it's strong, and most of the side effects you read about are from IV or oral administration. But this is, if you have aspergillus in the lungs, breaking up those adhesions so the alveoli can work, which speaks to oxygen saturation again, right? If aspergillus is in the lungs, it's going to negatively impact O2 sats. But yeah, I think that's a good point too, especially if it's been there for a while. And, in the southeastern United States, I mean, during the summer, even yesterday, I sweat walking to my mailbox.
Yeah.
And so I can't see it, but behind me, I have an air doctor and a dehumidifier.
Yes, I can
Um,
see it. We do too, all
yeah,
throughout the house. Hmm.
yeah, exactly. And, when you open those things up, you're like, wow, I would have been breathing this. And, Dr. Don Dennis made a good point. He said, I think you're focusing on food a lot, and that's good, but you're breathing 12 to 16 times a minute, times 60 minutes in an hour, times 24 hours in a day. So your air quality is probably more important than the food that you eat.
Oh, 100%. And there's an awesome link. Do you know Tori McGee? She's
Mm-mm.
local. Okay, she owns Holistic Home Zone. No, that's not it. It's holistic something. Don't quote me on that. But Tori McGee is her name. She's wonderful. She's basically like a holistic realtor, and she goes into before people will move into a home. She tests for EMF. She tests for mold. She tests the air quality to really advise these people if this is a safe home, and that should be the standard because you're right. The air quality that we're breathing in, it is massive to our health and
Right.
wellness. And we can't, again, we can't control walking down the street of the city what we are inhaling, but we can control our own home. And that's how I kind of approach it with patients so that they don't, because it can get to a place where, man, you feel anxiety and feel, well, what is safe? We just can control our home and making sure the air is pure and reducing all of the pathogens that comes along with it or the mold particles. That is something so simple that we can do to better our health in the long run and for our family's sake, our kids' sake.
Yeah, absolutely. And like you said, when I talk to realtors, because I have a client who owns a real estate firm, and he said, if a real estate agent knows that there's mold in the home and they don't disclose it, they can lose their license.
Mhm.
But the issue is, like, when I've talked to realtors, I'm like, hey, I want to be able to test. Well, I can't promise the house is going to be on the market. I'm like, okay, so
Mm,
you can get, I think they're cameras, but little devices to look for condensation behind the walls without
yeah.
messing with
Yeah.
anything. So you can literally just walk through and, without tearing anything down.
Yeah.
And then some companies, there's a good website, Mold SCI, like moldsciences.org, and
Okay.
they have locations in 15 or 16 cities throughout the US. So not everywhere, but you could probably have them refer you to
Yeah.
someone. But they have a little device where they can stick into the ductwork also.
Yes.
So my parents' house, they have dehumidifiers underneath the house and a UV light at the entrance of the ductwork, and an air doctor inside. So I've educated them well. I'm proud. It's like instead of a proud papa, I'm a proud son.
Yeah, exactly. When they start making those small changes, then you're like, yes, I got them.
Yeah, exactly.
So good for them. But even something like cleaning your HVAC system, life happens and we don't think about it. But cleaning your air ducts, cleaning your HVAC system, every six, depending where you live, every 6 months, making sure the humidity in the house is where it needs to be to not allow some of these pathogens to overgrow or fungal, species to overgrow. Those are very simple things that we can do to minimize our exposure in our own home and to purify again that major nutrient that we are exposed to more than anything else in the world.
Right. And to your point about, breathing and oxygen saturation, most sinus infections, I've read between
Yeah.
90 to 95% of all sinus infections are due to mold. But what do people do? They run to their primary care. I got to have an antibiotic.
Yep.
And then they feel better, probably because some secondary anti-inflammatory effects that they're destroying their gut microbiome. And then 3 months later, 4 months later, they're back in, oh, I got another sinus infection. And then, after a year and a half, 2 years, their microbiome, their alpha diversity is like this wide. And so their immune function is,
Tanked. So I use a cool nasal swab. I don't know if you're familiar with Microgen DX. I like them for urine samples. If I ever have a patient who has a UTI or something, or just chronic urinary tract symptoms, I run it through. But I also love the nasal swab because instead of me having to take a nasal swab and then checking boxes for things that I want to, check for, like you have to do through LabCorp, MDL, or any of those, it runs it through a database of 65,000 pathogens,
wow.
including bacteria, viruses, fungi. And I'll tell you, I have not had one sinus infection-esque patient, whether it's acute or chronic, that has not come back with at least 3 or 4 fungal species within the nasal cavity.
Wow. That's amazing. And then you recommend certain therapies to address whatever pathogens come back.
So that is a time where I will either do some sort of nasal rinse, like you said, or nebulize, or if it's a more systemic mold exposure where they have recurrent sinuses, even if I recurrent sinus infections, even if I haven't tested the NARS, I will nebulize some amphotericin, or if it's mild, something like silver. But yes, they do it by there's level 1 and level 2. The level 2 is more specific to the DNA. of
Right.
the species that's found, right? And so you look at it and it puts it in kind of an order of priority at a percentage of how much the species is replicating. Some of them are normal to our microbiome, even within our in our
Right.
nose. So those, no, I'm not treating unless it's an opportunistic organism, such as, a strep species or a staph species that should be there. But at this point, it's overgrowing by 100%. Yeah, I'm going to treat that specifically and kind of readjust the microbiome within the nose. Otherwise, if it's pathogenic, yes, treating it 100%.
Yeah. And with kids who have, let's say you were born via C-section, so I was.
Mhm.
Back then, I think my mom said, the pediatrician said, "Oh, there's really no difference between breast milk and formula." I mean, I'm like,
Don't get me
uh,
started.
yeah. I'm like, come on, like you don't even need to be in the medical field to realize that's total nonsense.
Yeah.
But at any rate, how much of the microbiome can be reconstituted?
Depends on the age, I think. If I have a kid, so really between 0 and 3, if we're talking about our microbiome in its entirety, gut, skin, nose, wherever, mouth, but I think the most integral time is between 0 and 3 years old. That is why there's so much literature that says even one round of antibiotics below a year old increases the risk of that kid to have recurrent ear infections, strep infections, chronic constipation, asthma, allergies, you name it. So I think in terms of the most integral time, it's that 0 to 3 mark. I
Yeah.
am always, and this might be a toxic trait of mine, who knows, but I'm always one that says that we can always do something. So
Yeah.
if there's a 90-year-old that is, diagnosed with Crohn's and IBS, I'm going to say, hey, we can do something about this. No time
Yeah.
like the present to get anything out the way that needs to get out the way in terms of pathogenic, re-diversify the gut microbiome, make sure the permeability, your GI tract is intact, inflammatory markers are down. I don't think you could hit me with any time in life where I would say that's impossible.
Yeah, and now we know. So my grandmother passed away from Alzheimer's back in 2014, and to her neurologist credit, even though he's very traditional, he recommended probiotics. Now I ended up getting her a different one,
Wow.
um, because, but he was up to date on the literature, so we know that any neurodegenerative label, diagnostic label, is preceded by at least 2 decades of gut dysbiosis.
Yes.
And so what I've read, for every one signal the brain sends to the gut sends eight back up to the brain. So hence the saying, fire in the gut, fire in the brain. Yeah.
Yes.
And so, go ahead.
No, I was just gonna, it's a very cut and dry example of that too. I did my whole dissertation on kids on the spectrum and the severity of their behaviors as correlates to the severity of their gut health. And there is 50 plus years of research on that. So absolutely, in terms of that gut brain connection with any sort of neurocognitive disorder, it is so closely linked. And we can see that very clearly in kids who have autism.
Yeah, I think it is possible to optimize the gut microbiome. I know the years from 0 to 3, like you mentioned, those are critical. But for people who weren't aware, like I was born in 1981, I didn't start studying functional integrated medicine until 2004, 2005. And so now I still have a ways to go, my gut microbiome, but
Yeah.
there's always room for improvement, right? But I think you can certainly intervene later and make major improvements, if not get back. And I think, now after probably spending, I don't even want to know how much I've spent on probiotics over the years. I think the prebiotics are more important than the probiotics.
I know. I agree. And we're constantly learning, right? As we're constantly just evolving into our knowledge and shoulda, woulda, coulda. I think with my kids all the time. I have 4 and my oldest is 8. I'm like, man, if I knew what I knew now, what I did when you were a baby, I would have done things so differently. But that's life. And it's the same way. We learn as we go. And I do agree. I think at any point, optimization is available. And that's why in practice too, I don't take age as an excuse. I have so many patients who are young in the scheme of life, mid 50s, early 60s, or mid 40s. And they're like, well, I'm getting older. And so I just think this is normal. And I'm like, no, no, I don't take that as an answer, you
Right.
know?
Well, and that's the thing. I think as a society, we've normalized pathology
Yes.
because I'll say, "How do you feel?" "I feel good." And then they tell me, they have like 3 autoimmune diagnoses. But, Sally down the street, she has two types of cancer, an autoimmune disorder, degenerative joint disease, sleep apnea. I'm like, that might be common, but it's not normal. Normally, when people say it's normal, they really mean it's common. But
Yes.
there's a big difference between common and normal.
Oh, absolutely. Even things I see this all the time too with like PMS like symptoms. And it's so normal. Back when we were in high school, it's normal for girls to just stay home because they're having such bad cramps or bleeding too heavily. Like that's normal. No, it's not normal. But we have normalized it as a society to think that those symptoms are normal and they're not truly symptoms. Whereas to me, it's screaming, hormonal dysfunction. But to them, they're like, yeah, I feel good. But I mean, the first 2 days of my period, I have to stay at home because my cramps are so bad and I'm having clots. And I'm like, but okay, so we're not good here.
Yeah,
Clearly there's issues going
exactly.
on.
Right. And I think the same thing with like libido. I mean, I
Yes.
see guys, I read a stat a couple of weeks ago that said the average 20 to 21-year-old today has the testosterone level of a 70-year-old from the year 2000.
Yes.
That's staggering.
I see this in teenagers too. I'm seeing early puberty in girls, delayed puberty in boys. I'm seeing 18-year-old boys with testosterone of 150, 200.
Wow.
I mean, low. And I have a bone to pick with these reference ranges on labs because, just a couple years ago, the lower limit was 394 to what, about 1120 or so.
Yeah.
Now it's shifted down to be 264 to 960 because more men just have lower testosterone. That's not normal. But by doing something like that, we are normalizing the fact that men's testosterone is decreasing.
Right. Well, yeah, if you look at the literature, and I know you know this, but for the listeners and viewers, anything below 550 nanograms per deciliter, your risk of all-cause mortality goes way up. And that's just all-cause mortality. Now, you still probably won't feel good until around 650, 700. But I hear conventional doctors say, oh, I'm really worried, this person's total testosterone is 850, 900. I'm like, worried about what? They're going to be healthy? They're going to feel good? They're going to
Right.
have, intimacy with their partner. They're going to
Longevity.
have energy. Oh, I'm scared too. I'm so scared. I think we forget about testosterone's impact on the Krebs cycle. And
Yes.
so the heart's very mitochondrially dense, the brain, the gut and liver. And so, and in women, well, women and men, but especially women, it's really important for bone mineral density. So my mom's on it. And I think it's really malpractice to not be on it, to not put people on.
Yeah, absolutely. Depending on the age, let's say I have, a 35-year-old postpartum woman. I've seen this all the time where they have, and women's reference ranges are obviously different, but it's either undetectable, less than 3, or at a 5 to an 8, which is very low. Most women, I'd say, feel good, kind of perfect mid range around a 30, 35 or so. And so that woman, I might dabble and kind of go upstream to see, okay, you should be making this testosterone in terms of that pregnenolone pull, what's being pulled, right? What's being pulled that's causing that testosterone to be deficient? And are you
Right.
metabolizing it too quickly to dihydrotestosterone, or are you sticking onto it with DHEA and not metabolizing it down to testosterone? What's your estrogen progesterone ratio looking like? So there's different instances for sure where I won't jump right to always bioidentical testosterone. But I absolutely, if we're talking about postmenopausal women or men, it depends on the goal. But I think one, figuring out why it's deficient, if it's an appropriate time in life to figure out why it's deficient. And then two, absolutely making sure that it becomes efficient in terms of overall health, not just that oomph and motivation and kind of drive type of feeling, but cognition and cardiovascular health, bone health, all that is so important.
Yeah, and I think, like you said, the reference ranges are so skewed. And if you look at testosterone's effect on the heart, we got it wrong. So, like, I don't know in Georgia, but here in South Carolina, you see the class action lawsuits about, oh, testosterone causes heart attacks. Well, that's one study, and what they did, I'm sure you know this, they took men who had a level of around 250 nanograms per deciliter. They gave them just enough to get them to around 350, which is still a minimum of 200 points below where they need to be. And people had heart attacks. And I said, see, I told you testosterone causes heart attacks. No, you didn't give them enough testosterone.
Yeah. And that deficiency was how long in the making, that
Right.
led cardiovascular event as well. I feel the same with cholesterol. If we're talking about cardiovascular health, holy moly, where us in America, we are so scared of the term high cholesterol. But if you look at the literature, cholesterol of at least 220 is what is protective for the right reasons. Again, right? Not LDLs being quote unquote high, but HDLs. But that total cholesterol, if it were at a 220, a conventional doctor would be like, oop, here's a statin, it's too high. Nobody is just doing math, simple
Right.
math of looking at the ratio between those HDLs, LDLs, and saying, hey, no, you are optimal here. That ratio is below 2.5, you're optimal. Yes, it says total high cholesterol, but that is protective of you cognitively in terms of your hormones. Our entire hormone cascade starts with cholesterol. So it's ridiculous that we have put everyone in America at this deficit, which then impacts all of our hormones, our thyroid function, our cortisol, our sex hormones, and everything in between. You just got me started on a rabbit hole.
Well, yeah, not only that, they're forgetting lipoprotein A,
Yes.
apolipoprotein B,
Oh, exactly.
myeloperoxidase,
Mm-hmm.
oxidized LDL, HSCRP. So we just created a customized cardiovascular panel. I interviewed Dr. Jack Wilson, the paleocardiologist, and we talked a little bit about this. But Dr. Daniel Amen, he says when he started out working in the prison system, the prisoners with the most violent outbursts had the lowest and really low cholesterol levels
Mm-hmm.
because their brain's not working. 30% of your cell membrane is made of cholesterol. Cholesterol is not trying to kill you. And it gets converted to pregnenolone, to your point. So if you drive it low, then you're going to have erectile dysfunction. Oh, well, here's some Cialis, here's
Yeah.
some sildenafil, all those medications. It's just like with thyroid, up until I think it was 1990, hypercholesterolemia was indicative of at least subclinical hypothyroidism because cholesterol and thyroid go in opposite directions, right? So they realize we can't sell as many statins if people have optimized thyroid levels. And the same thing, someone goes on T4, T3, nature thyroid, armored thyroid, and people are especially traditional endocrinologists, they're like, oh, well, they're TSH. I'm like, no, that's what it's supposed to do. It's a negative feedback loop.
Mm-hmm.
Like it's okay. TSH is not even a thyroid hormone, it's an anterior pituitary hormone.
Exactly. Yeah.
Yeah.
Exactly. There's so much in that there's, and I try my best in terms of being in front of patients and explaining that all those hormones are a web. And if one is off, if we pull one way, then it sends this cascade to all of our other hormones and causing malfunction and dysfunction. And it does, all of those do stem back from cholesterol. And you talked about the lipids and kind of brain health as well, that there's a reason why patients who are people who live more of a Mediterranean type lifestyle with all those good fats, their longevity and their lifespan is higher than the average American. It is so crucial to just our existence and our entire being. And we're
Yeah.
so scared of it. We're so scared of it in America.
I know and we have elementary school kids on statin.
Yes. Oh my gosh. Okay. This is so irrelevant. I'm gonna say this. I had to do a research for my license the other day, and it's all conventional, right? And there was a question about a 3-year-old who is diagnosed with ADHD and what medication would I put them on, right? A 3-year-old with you're diagnosing a 3-year-old with ADHD and then asking me what medication I'm going to put them on. That explains everything about our country. It is
Yeah.
wild. It is absolutely wild.
Well, I think, RFK Jr., Maha, Make America Healthy Again. I think he's going to be an important part. He's the only attorney that I know of in history that's beat the FDA, the NIH, CDC, and Monsanto in a court of law.
Oof.
Corporate capture of our regulatory agencies. People think that they're like for years, I mean, years, the CDC claimed, oh, we don't receive any money, any funding from Big Pharma. Now, on their own website, by their own admission, 46% of our annual operating budget comes from Big Pharma.
Mm.
And so, but people view them as these objective third party agencies. And I'm like, that's not how it works.
It's not how it works. You have to look at who funds the literature, who funds the studies. And even so, a lot of these pharmaceutical companies, the failure occurred or started when a relationship began between the FDA, who's a regulatory body, and the drug companies. There should be no relationship there. That
Right.
relationship creates bias. So now you have that relationship and you have a drug company who is responsible for its own studies instead of an independent study coming in. and then a company who's profiting from that drug coming out. And we wonder why 10 years later we have all these drugs being pulled from the market because they're causing
Yeah.
cancer.
Yeah. Well, look at Vioxx, right? The COX-2 inhibitor killed over
Yeah.
55,000 people before it was pulled from the market. Then emails were leaked that the company knew it all along. But, I learned this several years ago that if I'm a pharmaceutical company and I do 10 clinical trials, 9 of them show negative outcomes. One of them shows a positive outcome. I cannot tell you about the 9. I
Yes.
just tell you about the 1. And
Yes.
that's how they get away with it.
Right. But we are crazy over here using natural agents.
Yeah. Yeah, it's funny. People are so like brainwashed. We're one of 2 countries, I think New Zealand's the other, where pharmaceutical companies can advertise direct to consumer.
Yes. Yes. That I actually learned that fact this year, a couple months ago, and I was actually surprised that New Zealand was the other country, to be fair.
Yeah,
But yes, I always, when going international, whenever we turn on the TV, that's one thing I would always notice is, wow, there are no drug commercials. But it cuts out, there's such a problem with that because now
yeah,
you are the consumer, and I show a commercial of a happy family of, weight loss and this magical drug. And now you, as the consumer, don't pay attention to the rattling at the end of the commercial of all the 200 side effects, but more like the happy go lucky family. And oh, that could be me. So now I'm approaching, the consumer is approaching the clinician to ask for that drug versus the clinician assessing the patient unbiasedly and coming to the conclusion, the unbiased conclusion that this medication is needed for the patient. It skews it so much, and that should raise a huge red flag. Why are we trying to promote these medications? Where is the promotion for eating well, for grounding yourself, for taking care of you mentally, physically, emotionally, for calming your central nervous system? Where are the commercials for being preventative, for micronutrient deficiencies, for gut health? Where are those commercials? Instead, it's
yeah.
up.
It's super interesting that like Cheerios can advertise we lower cholesterol, but if you have a supplement that has red yeast rice and you say we can lower cholesterol, bam, FTC fine, warning, cease
Right,
and desist.
right.
You know,
Even though it's a natural statin, like it is
yeah,
literally a natural statin. But
and
I
it
know,
actually lowers LPA versus raising it like some statins.
yeah, exactly. It's very frustrating. And that it's all a marketing scheme in that
Yeah,
sense. No, it's the same thing. If something is labeled as gluten free, okay, well, I can't eat gluten, so this is healthy for me. This is good for me. But you turn it around and it has 12 different preservatives, artificial food dyes, and known ingredients that are group 1 or group A carcinogens. But it says gluten free on the front, so it's okay.
right.
Crazy.
I know it's crazy, but I think, at least there's a little more awareness now than there was 10 years ago.
Yes.
What's something, speaking of 10 years ago, what's something that you know today that you wish you would have known 8, 10, maybe 12 years ago?
Ooh, clinically or personally or both?
Both.
Okay, so if I backtrack to 8 years ago or so, that would have been, or 10 years ago, that would have been right in the mix of my whole Lyme journey. So very personally, we talked about this earlier, but I wish I knew about SOT then. Like it could have prevented me from being ill for a very, very long time. Now, fast forward, I'm really glad that I was ill for a long time because it makes me a better practitioner and able to communicate with my patients in a way where they know I get them because I've been there. So that's one thing personally for sure. Um, I would say lifestyle wise, I wish that at that point someone had kind of prepared me for taking care of myself in the long run. That for me was right after college years. And I look back at college years and I'm like, how did I survive?
Right.
I ate nothing. I was an athlete. I didn't take care of myself. And so I wish that I knew how to better take care of myself then. And I had the tools or the resources or the guidance to understand how important nutrition is, how important just baseline kind of supplements are, how important it is to get your rest, how important it is to just do whatever we want to put under the umbrella of self-care, because I also think that could have prevented my illness from being as extreme as it was.
Hmm.
I would say that.
Absolutely. Well, thank you so much for your time. Thank you for the work that you're
Yeah.
doing. We're going to put the links up, but real quick, what's the website where people can find you?
Yeah, so our practice is Discovery Wellness Group. We're in Georgia, so you can go to www.discoverywellnessgroup.com. I also have kind of my online platform is very different. It's only educational. I don't see patients through that platform, but that's the Discovery Doc, thediscoverydoc.com. Instagram, all my handles are at the Discovery Doc. I have some cool guides on there that are mainly focused on more kind of postpartum women, hair loss, just holistic guides and things that I have up there, a lot of resources as well. So yeah, those are the two places to find me.
Awesome. Well, thanks so much, Dr. CeCe, and hopefully we can have you back on in the future.
Thank you so much. I love our conversation. I appreciate your time.
All right. Have a great day.
All right.